Well, thank you all. I'm sure we'll have others trickle in, but I wanted to get started and thank everyone for joining. This is part of a series of webinars we've been doing just to check in on our community, figure out how to help. We did one the other week on with local mayors and city council leaders and seeing how their experience has been and get a bit of a window into their decision making and how they're trying to help their communities. And this is another part of the equation that's come up a lot. I was talking to Pamela earlier and was saying how on Facebook, occasionally somebody will say, and sometimes there's a moment where they say, you know, I know on Facebook people just mostly show happy moments, but I just want to say I'm having a really tough time. And I've had that occur with a number of friends. And I've done that myself even earlier in this pandemic when I was having a particularly bad day. And so mental health has, I think, become part of the conversation here. And I'm very fortunate to have known Nancy Lublin for many years. Nancy Lublin is the founder of Crisis Text Line. And Crisis Text Line we'll hear more about, but started relatively recently, but has already processed I think like 130 million messages of help and support. And so I thought, what a great way to start this conversation to have Rachel Kopelan. Rachel is from the Bay Area, and she's the director of coaching from Crisis Text Line, as well as Pamela Weiss. And Pamela Weiss is local here in Palo Alto. She's been involved from the very beginning as a counselor. She's an advisory board member. She's recruited other counselors, so she has a vast experience. She's also on the board of Life Moves, and she's been having a lot of conversations with local psychologists and local leaders in that field across the spectrum. So she has a variety of perspectives here. So what I'd like to do is start out, and then of course we'll leave time for your questions. If you can, please send questions directly to Jesse Brooks. Jesse will be reading off the questions at the end, so you can send them to Jesse directly via the chat. So Rachel, maybe you could take a moment and introduce yourself. And one of the things about Crisis Text Line is not only to provide direct service, but has become a kind of key source of information, really, I think across the spectrum for how are people doing now, right? What is happening in America? Because there's so many people now using a platform that you're getting great insight. So Rachel, maybe you can talk and give us kind of a quick overview of Crisis Text Line and maybe start off with some of those higher level stats.
Yeah, sure. So hi, everyone. Thanks so much for coming today. I'm Rachel Kopelan, Director of Coaching at Crisis Text Line. Our team, the coaching team, is the training, volunteer support, and engagement team. And I'm here in New York City, originally from San Mateo County. So really excited to be here. This is a really, really difficult time for America. Crisis Text Line, we're fortunate that we're all via text. So we actually have the largest mental health data set in the country. When this all started in March, the first few weeks of COVID, which we'll call wave one, we saw a lot of texters text in about anxiety, about the virus itself. And then a few weeks down the line, wave two was about issues associated with the quarantine, like being stuck at home, increases in domestic violence, sexual abuse, depression, but that appears to be plateauing right now. And then the third wave right now, which we're in, is about job loss and grief. So the after effects or the scarring of COVID, job loss at the start of COVID, quarantines in mid-March, words associated with lost jobs, income appeared in 18% of conversations. Last week it was 27%, and this week it's above 30%. In terms of grief, we're seeing a lot more texters experiencing grief, and they over-index with poor, Black, and/or Native American. And then texters mentioning they've experienced the recent loss of a loved one has increased from 9% in mid-April to almost 14%. So we're seeing a lot of grief and, hard times for America. A positive piece of data that we have been seeing, though, is people are continuing to reconnect with their friends and family. So hooray for old, friends and people you haven't seen in a while. It continues to grow with almost 37% of texters responding that they've reconnected recently with someone that they haven't seen. And then some of the top 10 trending words are about people's situations, home, finances. So those top 10 trending words are lockdown, pandemic, essential, quarantine, COVID, social distancing, laid off, home, closed, and unemployed.
Yeah, fascinating. And Pamela, how does that fit with what you are experiencing in your own work as a counselor, and what you've been hearing, talking? Maybe you can tell us about some of the folks that you've been speaking with to get their thoughts.
Sure. Thanks. First of all, Josh, thanks for having both Rachel and I on. We always really welcome the opportunity to talk about mental health and crisis text line. And although I want to say up front, I am not a trained psychologist or therapist, but I am a trained crisis counselor. But I think anybody is qualified these days to talk about their own mental health, as well as what we're experiencing as a nation, because we're in a historic scenario that really does level the playing field, that it'd be very difficult to come across anyone today who hasn't had a scenario where they question their mental health at any given point. I have been volunteering with Crisis Text Line for 4 or 5 years at least, and during that time I also volunteer for Life Moves organization, and as we know, mental health and our most vulnerable populations go hand in hand. And in conversations with Dr. Brian Greenberg, who is head of their services and programs for Life Moves here, which operates 17 Bay Area shelters and figures prominently within San Mateo and Santa Clara counties in trying to figure out solutions that address the COVID-19 crisis. It's hard to shelter in place when you don't have a place to shelter in. But the number one thing for the vulnerable population of homelessness that they're seeing is actually a positive indicator. I thought I would share it right off. And that's that we're seeing a level of graciousness and cooperation with people who are homeless in getting the services and engaging them to move in, which is a blessing for an organization like Life Moves, because they are beginning to accept help in ways that we have never seen before. So in some ways, it's making our job as trying to transition people from temporary or unsheltered scenario to permanent housing. On the other hand, that does lead us to have to deal directly with what Rachel highlighted is pre-existing conditions. If you were struggling with anxiety or depression or substance abuse prior to COVID-19 scenario, those are going to be exacerbated for lots of reasons: close proximity, access, and simply being isolated even further. So they have seen an increase in dealing with those in our most vulnerable populations. I think after that is that it's important to keep in mind that this virus does, the effects of this virus in terms of our society disproportionately affects lower income families. Poor families do not have all the options that the middle class and above do in terms of what it means to be at home when you are in a very confined space and you may not even have full-time or only a single access to the internet. Kids are trying now to take final exams. Students are trying to do work still. They may have several siblings running around. They may have a parent who's trying to work or a parent who is laid off. And so it becomes really difficult for those families that don't have a lot of options. And I think what that contributes to, from what I've been talking to therapists that deal with young adults as well as children, is that there increases the opportunity, unfortunately, for this anxiety to manifest itself in abuse and increased violence. So we are seeing a raising of the statistics, as Rachel mentioned, at least in the previous weeks, of domestic violence situation, and particularly our most vulnerable. And this reflects in our crisis text line statistics too, Rachel, that you mentioned, is that our 13 and under texters, their concern about their own safety at home has increased. And I think that's continuing to increase. And that's something for us as a society to be aware of and to be vigilant about, understanding and realizing that there are children that are at home, as well as domestic violence situations, who may be at home with their abusers. And that creates a lot of worry and scenario. I think going forward, what we're seeing is what Rachel had mentioned overall is the statistics is that we're sort of in this wave now of looking ahead, and we're in this grief process. And that's reflected in the information I've gotten back, is that we have all dealt with this trauma. It has manifested itself in different ways for all of us, but we're now looking at a society of moving past the trauma and focusing on grit and resilience. Finding ways to begin to bring ourselves back into whatever the new normal is, what the new routine is. And there's obviously a lot of uncertainty around that. So I think that grief is actually a good term to kind of as a catch-all phrase for what that means, to leaving what is behind and trying to move forward.
Mm-hmm. Yeah. Wow. A lot of great insights there. Thank you so much for sharing and for sharing your discussions that you've been having with
Sure.
local leaders. Rachel, maybe you could talk us through what is the training process like as you were head of coaching, and have you seen an increase in wanting to volunteer and help?
Yes. So since COVID started, we've seen an uptick of 11 times the applications to volunteers than before COVID. So our team is extra busy trying to get people through the application process and then into training. We currently have a team of 18 coaches, and each coach will be the head of a training cohort, and they will take people through our 30-hour online training, where they'll become a certified crisis counselor. So our training is comprised of videos, textbook reading, live activities where you can practice taking simulated conversations with texters before you actually get on the platform. So yeah, we're super busy. We've increased, I think, our training capacity in March and April by like 75%.
Yeah. And any insights in how to talk to people during this time? I mean, when you're training your coaches, is there things kind of specifically around, COVID that you're doing, things that you're training counselors to flag or to look out for, or how to talk about certain things? Any insights you can share on that? And this is for both of you.
Yeah, I mean, our training, we always teach our crisis counselors that they can handle any conversation, whether it's a domestic violence conversation, a grief conversation, if somebody's suicidal. Our training sort of encompasses all of the categories. And I think we also call our crisis counselors empathy NVPs. So just to be extremely empathetic and let someone know that you're there for them and that you're listening and that there are resources and support out there for them. I think it's the most important thing. Pamela, if you have anything to add as well.
Sure. I think first of all, to know that the number of crisis counselor applicants has increased as it is, I think is both a testament to the strength of the service, because recruiting volunteers has been one of our gating factors for growth, to serve. We have a lot of texters to serve. And it's primarily those texters are in the worst need between 8 p.m. and 4 a.m. And so the ability to expand and have more crisis counselors in different time zones and doing that worldwide, either with the same languages or other languages, which Rachel might give a chat about later, is really crucial to be able to serve this very vulnerable population. In regards to, so I'm thrilled that we've reached this 8,000 plus active counselors, because when I first began, there were 200 to 300 when we were in all zip codes in the, all area codes rather, in the entire United States. And some days it would be feast or famine, and we were always scrambling. And so there is a better rhythm and flow. Having said that, although the training has been enhanced and it was excellent to begin with, the basic way that we are training for empathy and to look for signs is somewhat formulaic in nature, but very personal. And each crisis counselor brings their own set of unique skills to the table, and we sort of elevate that by really teaching and utilizing the steps to having a good conversation, how to engage in those conversations. You build rapport, and then you go through and explore what they're feeling about, and that just basically is practicing active listening. You move on to help identify a goal. They may be calling in for a specific issue, or they may not know why they're texting in, and then that's sort of more of exploring time. And then we really try to empower the texter to help participate and discover their own ways to identify and note coping skills. Some of those things can be so simple and basic as, well, usually when I get myself from a hot place to a cool calm, I listen to music, or I used to paint, or I don't know, I kept a journal years ago. Maybe I should do that again. So we want them to have that sense of empowerment. And then we try to create a safety plan where it's appropriate, that they are able to figure out, at least in the next 24 hours, how am I going to get from point A to point B if I'm managing my stress around my kids or for myself. And then ending the conversation in a way that is warm and inviting and not abrupt and, oh gosh, I got to get on to the next texter. Yeah. So we try to develop that, and that is still basic training. I think that's something we can practice every day on the street too. Yeah, totally. It's just this empathetic way of communicating with people and taking a moment. So Rachel, maybe you want to expand on
yeah, I think one of the things that we always do up front, and we launched this policy last year, is it's our always ask policy. So it's our risk assessment. Yes. To see how at risk the person is. If they're an imminent risk, we want to try to de-escalate the situation quickly and make sure that they know that we're there to support them. So first we look for suicidal ideation. We look for a plan, if they have a plan for how they might want to end their life. And then if they have the means near them, and if they do, we ask if they plan to end their life in the next 24 hours. And if they say yes to all 4 of those questions, we know this is a very serious situation, and we have mental health professionals, our supervisors on the platform, monitoring all conversations. And if they assess that this person is at imminent risk and we cannot de-escalate, then that's when we call in what we call an active rescue, and we call our local 911 services so that we can sort of send help out to that person as well.
Mm-hmm. I just want to add to that although it sounds scary maybe to the first time person for the first time, it's a very caring and very supportive environment, and it's a very collaborative effort for it to get to that point. Yes. I would flag a supervisor. The supervisor has appropriate mental health degree to assess that, takes a look at what we're doing. I also have, when I'm on there's a group chat that I can constantly ask my fellow crisis counselors for quick advice, or if I get a term that somebody uses, an acronym in their text that I'm not quite clear on, I can quickly ask, oh, that means this, they're talking about this, so that we're able to move. And one of our key crisis counselor trainers always likes to talk about us as being seaweed, that we're floating back and forth from one issue to the next, or from serving one texter, because we will handle multiple texters at one time. And so we'd be like seaweed and flow back, and you get in this rhythm of doing that, but it's because you're so supported on the platform, you're never alone. So it's not as scary as it sounds to engage in this type of a high-risk conversation.
Good. Well, that's all very helpful. It's one of the reasons I wanted to have this, and because Crisis Text Line is a resource, but also a way to help. And a lot of people have been asking for ways to help during this time. And I know my wife is now signing up to be a counselor. In fact, I was working on her reference the other day
So awesome.
That's amazing.
Great. Yeah, that's great.
Rating your spouse on taking constructive criticism. That's a difficult thing to do. But yeah, this is one great way to help.
Yeah.
By the way, Ida Rose Sylvester, I know you've been involved as well and have started efforts in Mountain View. So if you would like to chime in here, please flag me. You could probably unmute yourself. Otherwise, we'll be taking questions very soon and try to send them directly to Jesse. I guess well, actually, why don't we open it up? There's already been a few. Jesse, do you want to start with the first few questions?
Sure. So this is from Arthur. What do you think about universal computerized broad-based behavioral health screening performed in advance of most physical health visits?
Any thoughts on that? Rachel or Pamela? We could also ask Arthur to elaborate.
Yeah, I think I'd need a little more elaboration on what Arthur's specifically referring to. In other words, is this just in terms of way we're assessing mental health patients or medical patients prior to actually ever meeting them? I'm not quite sure what the context is.
Well, this might not be in the context of the crisis text line, but the issue is triage before they get there. So they're typically going to meet with a physical health. The statistics show that a large portion of the people who attempt suicide have seen a physical health provider in the last month or two. And the physical health provider was not even aware of the mental health issues. So the idea, and I'm not sure how high the statistic is, but anything is ridiculous, too high. So the idea is to send out some sort of link to the patient, and the patient fills out a broad-based questionnaire, not just the PHQ-9 and the GAD-7, but what I do and the work that I do is have a 22 different scores, broad-based kind of different kind of things that give a big broad picture to the clinician as to what's going on, so they know, whether the pivot to a mental health visit or a warm handoff, or whether it's just a physical condition and not to worry about the mental health, so that they can triage that in advance. And that's what I'm trying to work on. And I think that, well, you're offering a great and valuable service, but in some sense, what can happen is that in the physical health. For example, sometimes a patient might go into a doctor's office and say, my stomach is bothering me. And what's really going on is they have high anxiety, and if the doctor doesn't screen for the anxiety, then the doctor will treat for the wrong thing. And it may be comorbidity between some stomach thing and anxiety, but you've basically got to treat for what the presenting, not only the presenting symptom, but the actual cause.
So I can say one thing about crisis text line in relation to that, is that because of our ability to data mine the information anonymously, keeping patients, what we are able to do is, for the first time, is to really see, I'll give you an example of a pediatrician who often sees, young children who have a stomach ache, which is actually a leading indicator of high anxiety, right? Especially for children, they won't say that they're anxious, they don't want to go to school, they'll say I have a stomach ache, and that's actually pretty common to hear online. But currently, the conversations that occur between pediatricians and young children, there's certain questions a doctor would ask, a doctor physically checking them out. And they are trained and they are designed to look for things such as abuse or distress. But do those conversations and those vocabulary actually match up to what we hear on crisis text line directly from a 12 or 13-year-old texter? And the answer is not always. So are the pediatricians asking the right questions when the child is face-to-face with an adult, and what the answers they get may look actually pretty different when a child is in privacy texting directly in an anonymous way? And so in sharing information with medical organizations, and Nancy would have to, or maybe Rachel can allude to it, we do this. We share information that in our data that we can, when we learn, to law enforcement organizations about hostage negotiations and so forth. And I've talked to some local hostage negotiation teams and what are the words in the process they use in our process, and where does it intersect, and how is it effective and how is it not. The same is true for the information we're getting. Is it, are we asking the right questions to some of our most vulnerable patients who are cross over to a pediatrician? And the answer is that conversations might look very differently if when the pediatricians see what the children themselves are saying that is indicative of them being abused or in mentally distressed situation.
Yeah, well, that's good. I like that idea. That is one of the interesting things talking to Nancy is, being able to do that kind of mining, and then in fact, you're actually sharing it with physicians. And Arthur, I think that's also something that I'll take going forward as well, and love to follow up with you about, because that's a great point. If people are already going to see this physical therapist, and if we can gather some more of that information in advance, then we could probably, do better treatment and identify some of these conditions. Great, Jesse. Next one.
So this is from Leo. What can you do to help a person's physical situation? If someone needs to get out of their house because it's not safe there, is there a place for them to go that you can offer? What's the procedure there?
Yeah, how does that work?
Yeah, so we have a number of free resources that we recommend to people in, who are texting in and need a safer situation. So we have a head of global referrals and resources they're constantly vetting resources for people who may need counseling or to a safe place to stay for a few days. That's all on our platform that we've created as a resource for crisis counselors to give out to texters.
Mm-hmm. Yeah, and I think Rachel, 211 is a resource. One of them that we use, which you can particularly for domestic violence and particularly for families, whether they're looking for shelter because of a violent situation or they just need a safe place. That is something that we connect them to often. I will say anecdotally, locally, in speaking with a therapist who deals with young adults here in the Menlo Park, Palo Alto, San Jose area. She has been working, this one therapist has been working along with some homeless shelters who have identified some low-income at-risk families. And they have actually, in terms of domestic violence scenarios, they have set out a package of sanitary products for on the doorstep of the house that has had information tucked inside about if you are experiencing a situation that you need help with, here's the numbers to reach out to, and here's how we can get you help, as a way to get information inside a household that might be at risk, but without the fear of reprisal from the abuser inside. So people have been creative in this scenario, as well as the usual tools that we provide on the service.
Nice, good to hear. Ida Rose, if you're there, I want to bring you in then, and maybe you could talk about some of your personal experiences and what you've been doing in Mountain View.
Oh, sure. Hi, everyone. Sorry, I'm going to stay on video mute. Bad hair day. I think every day has become one, but also bad bandwidth day at our house. I'm the Human Relations Commission chair here in the city of Mountain View. And even in the good times, we focus on our most vulnerable populations here in the city, immigrants, older people, our senior citizens, people with various disabilities, anybody that might be undervalued in our community or underheard and underseen. We're on a bit of a hiatus right now, but none of our commission members are. So we've all been involved in a bunch of different projects. And by the way, I am a trained crisis text line counselor. I should be texting more, and this conversation is giving me quite a push to go do that. It is
amazing.
Thank you.
Oh gosh, it's a highly, highly rewarding experience. And one thing I do tell people is, even if you can't be on very often, the training that you will get will be highly useful for you just in how you deal with people you meet on the street in life. I find myself using the methodologies all of the time when dealing with friends in actual real world crisis. It's been a life altering experience, so thank you. One of the concerns I have here in the city of Mountain View right now is the isolation of our seniors. There's also incredible food insecurity that's increasing. Our local community service agency is serving literally hundreds of seniors every week with food. But many of them are isolated. Many of them are getting home deliveries of food and not really having anyone to talk to. So I've started a program where people can write little notes, like a little postcard, a little handwritten note, a student's drawing, and have those delivered with their food. So we're definitely looking for more people to take part. We're getting really amazing and creative notes and drawings and quotes and handmade cards and everything under the sun. We feel it's really helping the people who are writing them too. It's giving them a creative outlet that's making them feel really positive. So if anyone's interested, you could private message me in the chat and I'll tell you more.
Great. So they would, yeah. So then you'd give them information about how they would get that. So just so I'm clear, so people here could be writing these notes and they would go along with what's being delivered to the seniors. Is that right?
True. I'm doing the collecting since our CSA is just too busy to take collections. I'm in Mountain View, so I have a box set up outside of my house, and I'm just taking notes continually. I'm happy to give guidance and advice. We have everything from postcards to pieces of construction paper cut up and kids' drawings on regular paper. It's really, actually, it's really heartening to see what people are doing and how much our seniors care about feeling that someone's connecting with them and really cares about them.
Great. And I'm happy, if you follow up afterwards, we can promote that on social media as well.
That'd be awesome. Thank you.
That's a great service. I know it was in our campaign, we've been checking in on seniors as well. But so the New York Times had a front page story about a week or so ago about how pollsters who are used to rejection are now finding people want to keep them on the phone. They're just happy to have somebody to talk to.
Yeah, so to that extent too, I've noticed in our stats that Rachel was presenting at the beginning, at the top of the hour, was that seniors are texting in to crisis text line at 4 times the rate previously. Yes. So if you did nothing else when you get off this call, text your dad or call your mom, grandmother, teach them how to use crisis text line, because it is there for that loneliness aspect too. It's an important lifeline.
So 3 times as many seniors, is that what you said?
4 times.
So,
or maybe higher now, Rachel?
I think the last we checked, it was 4 times. While seniors are not a huge, percentage of our texters, we tend to skew really young, but 65 and older texters have increased by 4 times during COVID. Some of the things they're mentioning, so almost 2/3, 64% of 65 plus texters have a fear of contracting the virus themselves, 25 points higher than the average across the board of all texters. And then 14% of texters, senior texters, mention recent experiences of racism or discrimination, which is 2 times higher than the average texter.
Right. Good. We got about 10 more minutes. Jesse, what's the next question?
Do you have supports for parents who need mental health support for their children?
Yeah, so again, with our resources, so crisis text line is more of like a crisis. We want to, de-escalate people who are in crisis and take them to a cool, calm. If somebody does text in and they need resources for their children, we call those third-party texters, and we give them our free resources as well in their area.
I actually want to also mention that in a national organization called childmind.org, there was actually a recent, Reese Witherspoon did a mental health touch base with the head of Childmind. And that's actually a really good resource on site. And they have a sliding scale to help parents in dealing with kids, whether they're already designated special needs or they're simply somewhere on the mental health spectrum, which they have done a lot of local fundraisers and they have a local presence. They recently, I think this week, began offering to our frontline healthcare workers a 30-minute free counseling if they call or email in, to basically just get a grip or a handle on whatever that specific issue is. And I think that was running this week. So if you want to visit that website, that's actually been a very
what was that again?
Solid. Childmind, like childmind.org. It's the Child Mind Institute. So www.childmind.org.
Okay. Jesse, maybe you can put that in the
It's
text.
Terrific.
Great. Thank you. Next, Jesse.
What strategies can people utilize to prioritize their mental health in these trying times? And as a volunteer, how do you cope with the conversations after?
Yeah, Pamela, do you want to take that one as a volunteer?
Yeah, I'll take it from the coping aspect of it. When you train with Crisis Text Line, in fact, my type A, well, previously type A, I'm a different person now than I was 5 years ago, but my previously type A personality, when I first sat down to train with the organization, was, hurry up, when are we going to get to the actual training? That's because a good 25 to 30% of the initial training is about self-care, about recognizing it, understanding the role that it takes, the fact that we need to prioritize that. We may say we're all stressed out about this job interview or what have you, and it might be that our brain is telling us that I have to cram, I have to study, I have to prepare, and when actuality we need to actually check in with ourselves and follow through what we know, and that goes from everything. We talk about very simple approaches with our texters that has to do with nutrition, routine, breathing. We all breathe, but we all could really benefit from learning how to be, as Brene Brown says, obnoxious breathers, where we really take our moment to register with what's going on with ourselves. In other words, to prepare for this, I actually was dancing around my kitchen, because that way I was like, okay, but in my old self, I might spend more time obsessing about what's going on. So right now, recognizing and prioritizing the thing that sounds like what we don't normally have time for. And it's hard. And I will emphasize routine, particularly for those who have pre-existing conditions before the lockdown. Routine may not look like what it did before. I used to go to the gym every day at 5 a.m., but having some sort of a routine, particularly for those that are dealing with young children or younger children, maintaining some sort of a routine through the day that blocks it off helps us to trigger our minds to focus on something differently. And this goes for in our homeless shelters, because so many of our homeless folks are used to going out and working part-time jobs. And so work has been one of the most valuable things in terms of giving our minds somewhere to go and focus. And so with the lack of that, creating a space, giving an opportunity for creativity or something that looks like doing something purposeful, and balancing that out with self-care, whatever that means for you.
Yeah, I think one of, the most important strategies is don't keep it in, reach out for help when you need it. There are resources out there, people you can confide in. And I think during this time, while everybody's quarantined, just getting it outside and getting some fresh air when you can, taking a walk and, walking your dog, doing a little yoga outside, we recommend. And then just prioritize your mental health check-ins, meditation is a huge one. Like Pamela was talking about, breathing. We have a number of grounding techniques and breathing gifts on our platform as well. And during this time, a lot of people are on their phones, a lot during the day. So turning off notifications so that you're not constantly, with your phone, I think is another really important one as well.
Yeah, no, that's good. I like that about routine. I mean, early on in this, I was sleeping much later than I usually would, and I was just kind of getting to that kind of contributed to just kind of feeling out of sorts, and now kind of back, at least during the week, getting up earlier and feeling that I'm been more normal and productive. Well, on that subject, I do see Jesse, I want to make you read, because I see something from Samir that a little bit longer, but and I think people can probably see it. So I think the question is really around the mental health, and I think Samir, before you got on, Rachel talked about the data that they're seeing and talked about sort of this wave 3 after effects of and kind of scars of COVID, including job loss and grief. And I think that gets to your question, right? Is how are we taking into account those real impacts into decisions around reopening? And I don't know if either of you, have insights, Rachel, if any of the data is being shared with policymakers, but I think it's something certainly that we can share and I can share with folks, because I do think that is an important part of the conversation. And Rachel, any thoughts on that?
Yeah, I don't have any data points on that just yet. I know Nancy knows a lot of people, our CEO, and she's been talking to some policymakers. So I can try to get an update from her on what she's hearing and how we incorporate our data into making smart decisions as we reopen the country.
And Josh, if I could maybe just put a little more color on the question and be a little bit more specific, and I apologize for being late. It's just one Zoom to the next, but this is something that is just super important as an employer with having to lay off our entire staff and the issues that they're going through. I see it on a micro level, but on a macro level, the data and the statistics are there. But what's been, I would say, frustrating is I'm on regular calls with a number of public health officers who are charged on a county by county basis, and maybe even more so after today's announcement from the governor, on making decisions based on health. And the constant discussion is COVID-19 health. And while that is extraordinarily important, I think particularly when you look at some of the more rural counties in our state, where the COVID-19 impacts have not been as significant from a health perspective, yet you have suicides, domestic violence, and other issues, along with the job insecurity, food insecurity, and housing insecurity that have extraordinary long-term health impacts. It just doesn't seem to be part of the equation in evaluating health. And we're really getting to the point where it needs to come in as a stronger part of the conversation.
Yeah, looking at health holistically, I totally agree. I totally agree, and I see that for from a variety of friends and local businesses, and so I appreciate you raising that. I agree.
I think just from a personal anecdote, the concept of scarcity, and obviously middle class and up, it means something different than our most vulnerable lower income populations. But the whole concept of scarcity, even the mental health effect of that anxiety, the grocery stores become the new, a war zone where you have to go to buy something, but you're anxious, and then it affects, and it's such a commitment to even go and get food that, yes, I think there are a lot of conversations anecdotally about food and waste and long-term. I have seen in some of my other group chats for other forums, I moderate another forum, that the discussion is about food, about growing your own food, about the long-term, about the broken supply chains that at least appear to be, the way the media focuses on, for instance, the beef shortage because of COVID-related plant closings and so forth. So this is something our grandparents were pretty familiar with, Depression era through World War II through now, but this is a really new concept to us where we're, the instant gratification society. But yeah, so it is impacting, and I agree with you, your note here on people delaying their own surgeries that they should be getting because of fear of entering into a hospital. All of that, what we know intuitively and by science is that all of that creates stress that affects our own immune system. So it's a vicious cycle. And there's not a clear-cut way. I agree with you with we've seen a lot in terms of our leaders, national and state level, so forth, that it's brand new. There's not a specific plan how that's going to be addressed. And that can be really anxiety provoking for the average person.
Yeah. We were due to wrap up, but if people want to stay a few more minutes, because there were a bunch more questions, maybe we'll just take one or maybe two more. Jesse, we got another one?
Sure. Is there specific help for people who are post-COVID and have anxiety around their past experience and moving forward?
I mean, who are positive, basically, you're saying, right?
Yeah, I think people who have recovered from the virus, but are maybe dealing with trauma related to it or anxiety related to it.
Do we have any resources that are specifically listed, Rachel, that we're using on the site? I would say at a high level, in generally, trauma is trauma. And we need to recognize it that just like we would deal with anybody who had PTSD after a near-death experience, that whether or not it's real or, just the fact that they might have been sick but not having been hospitalized, I think that, or perhaps that any cancer survivor could relate to the fear of that coming back, the fear of reinfection, the fear of spreading, the fear of, that's a lot. And so that would be, I think, treated in a mental professional office the same as any other trauma that would be dealt with. I think also there is a larger perspective that's happening now on grief. And I have heard from a few psychologists saying that they are dealing with their patients that in essence, they're just going through the 5 stages of grief, which has been something that's been around and utilized in the acceptance of denial, the anger, etc., about that. And that those are very much the emotions that someone who is recovering from this virus may go through. And so I don't know, I can't speak to any specific addressing of how they're looking at that differently, but grief I know is one, grief counseling.
Yeah, that makes total sense. I mean, it's a really smart question, and I think that we should seek out resources for people after who are post-COVID, and so that's definitely something that I can bring up with our head of resources, and we can try to find some to put on our platform for people to give out to texters.
I think that was my question. I just wanted to add one other piece to it. This is Eve Blossom. Is that I was COVID positive. I'm not talking about myself. Is that when I shared that information, there were tons of people that came out of the woodwork who said they're afraid now to go outside. Like, like they said, I had it as well. And until we hear anything about immunity, I'm afraid to go outside. And I thought, wow, it's getting to a phobia level of people not wanting to go outside. So,
yeah, and I think actually, Rachel, thank you for sharing that with you as well. I'm glad to hear that you're recovering. And I think you're right. And once I think more people talk about that, I've had communications from friends who were reluctant to even disclose that they had been sick. So it sounds a lot like mental health stigma, doesn't it? And so now that once we all are talking about it, so thank you for being brave and just bringing that up. I do think, Rachel, that is something we should be raising, because we do develop, and we've seen online communities develop support groups, whether that be through an LGBTQ child that is being bullied, and there's a support group online for that, and we point to that resource. We should basically be culling and cultivating a resource for just this. And so if anybody on this call, if anybody knows or has something like that they see forming at the local or national level, do let Rachel or I know via crisis text line, and we could certainly raise it and bring it up, because we're always adding.
Yeah, and Arthur raises an analogy to sort of the kind of a survivor's guilt, so that's in there too. Jesse, maybe because it's such an important topic, I want to leave room. Is there one more, Jesse?
Yeah, there are a few more. Let's see. Is there an opportunity to develop screeners for tweens and teens based on the text research you have done?
Screeners.
Maybe someone want to elaborate if they
Arthur, do you want to elaborate?
Sure. So the idea is that there are various kinds of test instruments that are well known for adults, and there are some for adolescents, but there aren't really good screener instruments for tweens and younger kids. And I'm wondering if the kind of language that these tweens and teens understand might be useful, and the kind of responses you get might be useful to create screening instruments for mental health that can be used in younger age, children and tweens and teenagers, adolescents.
That's interesting. That's a smart way to look at it. I
Yeah.
am on a leadership cooperative for Children's Health Council and here locally, and I'm going to ask that question. That's a fantastic thing. I don't know, and I don't know
Well,
how
I'd be happy to collaborate with you on that if you wish.
Yeah, I'd love to. I have a meeting next week, so I'll just text you with my email right now, and then maybe I can bring that up when I do get on a call with them next week.
Great, thank you.
Sure.
Right. Jesse, one more?
I'm looking, I think we're, Chelsea, you asked a follow-up, but I'm not quite sure how to phrase it. Do you want to ask your question, Chelsea?
See if I could maybe unmute her. Not quite.
Yeah, sorry, I was having trouble unmuting. It was less of a question. It was more my experience in talking to parents, just a follow up on the phobia of going outside and doing things for kids. Kids with issues, having already presented mental health issues, are not wanting to go outside, which is, problematic as well. So I was just tagging on to that.
Yeah. Chelsea, I know you do a lot of work with special needs children. Is there any statistics on children with special needs using crisis text line, or is there any particular resources there? I don't know. Just thought I'd bring that up.
I think some exist separate from this. If people are already receiving wraparound type services through the county, through their supports that they receive. So there are similar services, but I wasn't aware of this one. So I'm excited to have learned about it today. So thank you.
Oh, great.
Good. Rachel, any follow up on that too from your perspective? Or?
No, but I think that it's definitely something we should think about, and I can talk to Bob, our chief data scientist, too, about pulling data as well.
Yeah, that's actually, I think that's really good, especially since we see that there is increase in anxiety or our younger than 13-year-old texters are increasing. And so we know what it looks like in the jokes that are happening in the memes online about the mom with the kids running behind them while she's trying to carry on. But there's some very real significant statistics behind abuse scenarios that we've covered today about that happening, and they are very vulnerable. And so I think that parents of children that are now everybody's facing that what next, and how do you provide a sense of certainty and stability when you yourself don't know the answers? And I think that's actually something we could maybe pull some stats on and learn about.
Yeah, definitely.
Thank you for bringing that up.
One of the stats that always stick with me and has stuck with me, and our texters do skew really young, teenage years. 60% of our texters share something with their crisis counselor that they've never shared with anyone else before. So that's one of the stats that really, sort of is memorable to me. So I'm sure there's some data we can pull.
Yeah. Well, great. Well, thank you. Thank you to Pamela and Rachel. Thank you all for participating. I do want to mention our next session we're going to do is next Friday, which is the 15th. And it's going to be at noon with Erica Drazen, who is a doctor here at Enoch Troy. And they've both been quite active on the front lines of both treating patients as well as getting resources, getting PPE, and very familiar with what's going on, and both again here very, very locally. So please join us if you can for that. Please join me again in thanking Rachel and Pamela. Thank you all.
My
Thank
pleasure.
you so much for
Thanks for having
us.
Okay, great. Thanks, everyone.